In this episode,
3-hour treatment. She was able to sit up straight for the first time in 60 years. She had no pain, no discomfort, and her daughter told me a month later, she said, "Mom, keep singing your praises because she has no issues with incontinence anymore." We have hundreds of people that have been able to avoid surgery and many of them were scheduled with carpal tunnel, with knee replacements, with hip replacements.
Healing isn't done until roughly 12 to 15 months. Is that something you have heard? Something you work with?
What if I told you it's actually hours?
It's hours.
More often than not, we see near complete restoration in 2 to 3 hours.
Complete restoration.
Yes.
Hello and welcome to Health in Focus with Jacobus. I am your host, Jacobus Hollowijn. Today we're going to talk with Harry Lee Forbes, better known as H. Lee Forbes. He's a licensed massage and bodywork therapist, and he is located in Beckley, West Virginia. He happens to be in this area, and we decided to have a talk about what neuromuscular balancing is all about, and not just that, but some of the other ways that he works with his clients. And so it is absolute joy to have you on the program, Lee.
Thank you. It is a privilege to be here.
It's fun. You and I talked last year. We kind of got connected. And I have to tell you, I kind of forgot. And you were in town, and you called me, and you said, "Hey, you still want to do that podcast?" And I said, "Absolutely. Come on over." So it's good. I'm glad you're here.
Oh, thank you for your hospitality. It's marvelous. I'm thoroughly enjoying being here.
Yeah, the weather is not helping out.
The weather is a disaster.
It's a disaster. Now, Lee, you are with your wife. You're on Aruka Touch in Beckley, West Virginia. And what does Aruka mean? How do you come up with the name?
So Aruka is Hebrew. It means healing and whole body restoration, which is exactly what we try to do.
That's a complex thing for talking about health and my interest and my knowledge, what I've learned about health, because everything is the body or the mind or the spirit or the emotions.
Agreed.
So you are in my talk with you between the show is that you are looking at everything. There is a physical component, but you in your communication with your clients, you realize that what happens in the physical body may not have started in the physical body. It could. It may also start from certain stressors that have been built up over time.
Indeed. We find that it's all interconnected. All too often in today's medical environment, they become so segregated and specialized, so that if you've got an issue with your foot, but then someone says, "Well, his blood pressure's high, so we better send him to an internist to see what we can determine about that." Well, while you're there, they say, "Well, your sugar's high." Now they got to send you to an endocrinologist, and the next thing you know, you're just separated in all these different directions.
Absolutely.
And in reality, like you said, there is an interconnection with the whole thing. Everything is relative. And so, yes, we focus on that. For instance, one of the big issues that I run into quite often, especially with veterans, is PTSD. They'll come in with a physical issue, but it's based on an emotional response that they're having from their PTSD that is often carried in their pelvic floor, of all places. And because, as you know, the gut is the center of our emotions.
You bet.
And so that gut is supported by the pelvic floor. And when that pelvic floor is out of balance, well, that basically throws everything else out of balance. The next thing you know, you got people with migraine headaches that are coming out of the pelvic floor. You've got people with knots in the middle of their back that are coming out of the pelvic floor. But we can get into that more.
Yeah, it is really interesting what you say. I think that most viewers know that Western medicine has gotten into all these different modalities and specializations, and it makes it very frustrating for patients to travel from one town to the next, or within the hospital to the different floors, the different specialists. They have to do a whole new intake form. They got to tell their story again. And then that specialist is really only focusing on the one thing that hurts and what they think it could be. And often it goes together with medications to reduce the symptoms. And you and I both know that symptoms are symptoms, but that doesn't mean that's the cause. And every cause
Rarely,
has a symptom.
Yeah.
In order, I always say, wherever the weakness is in the body, that's where it ends up coming out. You know, if you take these
good point.
stress dolls and you squeeze them, you see it pops out here, pops out between your fingers. So wherever you put pressure on the body has to show you that, well, it hurts, and then it comes out.
Yeah, it's compensating.
Yeah.
It's trying to balance. There's a pressure here. You know, life is all about
It's all
balance.
about balance.
It's
Yeah.
all about balance. Everything. With the body, it's trying to maintain a straight and level. Most of the issues that we see as far as the body structure when it comes to alignment is where the eyes, which we call the window of the soul,
Yeah.
well, those eyes want to be straight and level.
Exactly.
So if there is something, say you've got a catch in your hip, and so you're leaning slightly that way because it's more comfortable that way.
Correct.
Well, that means you're tilting your upper body this way. Now my eyes are saying, whoa, I got to get this body back into an alignment because I want to be straight and level. So the next thing you know, where you've got this catch here you can't release, then the shoulder over here begins to drop.
Correct.
And now, and like we were talking earlier,
Yeah.
the beautiful thing about the body is it compensates. The bad thing about the body is it compensates
Yeah.
because it doesn't know where to stop. So if I got a catch here that's dropping my side this way, and then I drop the shoulder over here, well, now my eyes are saying, whoa, we came too far. So then the muscles on this side of the neck begin to tighten up to align those eyes. And you'll see people that their hips are shifted to one side, their shoulders drop to the opposite side, and their head is turned slightly like this. And it all starts because of this tightness in the hip down here.
Yeah.
And but the pain is generally in the neck. And so they'll go to the doctor because I've got this pain, or they'll go to a therapist of some sort, and I've got this pain in my neck. And so they focus on the neck.
Yeah.
And they'll get a little bit of relief, but it comes right back. When in reality, if they released what was locking them up down in the hip, then they can straighten out the back, straighten out the neck, the pain's gone.
I sometimes see people walking that look pretty far gone as far as their, let's call it almost their imbalance in their body shape. They either lean forward very much, they walk with a cane, they may have issues with the hip, the one leg may be shorter than the other. And I also realize, and correct me if I'm wrong, not everybody can be fixed, depending on what time it is. But I always feel that too many people go to Western medical modality, and there is a place for it, right? Instead of saying, what can I do to improve on where I'm at? And sometimes an improvement has to go in stages. I often hear that for every year that you have suffered, it roughly takes a month to a month and a half for the body to completely heal. So if you've had something for 10 years, it may be 15 months and before you completely heal. Now, it doesn't mean you don't feel better within a week or days sometimes, but the healing isn't done until roughly 12 to 15 months. Is that something you have heard, something you work with?
What if I told you it's actually hours?
It's hours.
Hours.
But depends on the severity.
It depends on the severity.
Right.
It depends on sometimes the longevity, how long it's been taking place. But more often than not, we see near complete restoration in 2 to 3 hours.
Complete restoration.
Yes, yes.
Wow, that is
Hip
very
issues,
special.
shoulder issues, lower back issues, knee issues. There are so many. In our practice, we have hundreds of people that have been able to avoid surgery and many of them were scheduled with carpal tunnel, with knee replacements, with hip replacements, and shoulder surgeries and so forth. Just about every part of the body, because in just a matter of hours, there was no pain anymore. And they had full range of motion. I had a lady come in to see me, 82 years old. She had not been able to sit up straight and had acute urinary incontinence for over 60 years.
So,
Because ever since her son was born. Well, that just simply means that the traumatic, and I asked her, I said, was your son's birth rather traumatic? And she said, yeah, it was a very difficult delivery. Well, that means to me that the muscles in the pelvic floor are out of balance. So if I take my fingers and I shorten one up, can I tighten this gap between them? No, I can't. So there's no way, if I put water in here, the water's going to go right through. There's no way I can stop it. But if I balance the muscle tension on both sides, now I can tighten it up.
close that gap.
That's the way urinary incontinence works. And partially prolapsed bladders, partially prolapsed uterus.
Which also can happen after birth.
Exactly. And so that's what she was having. And in a 3-hour treatment, she was able to sit up straight for the first time in 60 years. She had no pain, no discomfort. And her daughter told me a month later, she said, Mom, keep singing your praises because she has no issues with incontinence anymore. So, yeah, sometimes it can take a period of time. In our work, we don't set up treatment plans except for a chronic situation where they've got scoliosis, say, where it has been chronic over a period of time and they've actually twisted considerably. Generally, things are fixed pretty quickly because, like you were saying, the body wants to be healthy. The body wants to be balanced. It wants to be straight. It wants to be in homeostasis, we call it in medicine. It wants to be healthy and happy and operating. So if we can find the issue neuromuscularly that could be causing this twist or curve or turn or whatever, just by releasing the tension that's been there for 60 years, you know, you could name just about any period of time. If we can release the muscles that have been holding it in that position, or that have instigated other muscles to try to compensate, which has pulled it into these other positions. If we can find the core, fix the core, then the body can go back to what it wants to be, even if it's been 40, 60 years.
Which can indeed resolve issues that the person probably wasn't even thinking about.
Oh, indeed.
Such as heart health, digestive health, you know, lung health.
Indeed.
It all opens up.
Yeah.
It all opens up.
It does. It's amazing how many issues people are having they're not aware of because they've been carrying this pain and they've allowed it to limit them in what they do. And of course, when you've got pain, you've got cortisol levels that are just going out the roof as well. So and then cortisol just breaks the whole body down to a degree. And so they're battling all this. So if you can resolve the pain issue, then everything else starts to come into its proper alignment, its proper balance. It's amazing the differences that we can find.
So in this case, you're talking about an 82-year-old, which is an incredible story after 60 years of suffering. A lot of younger people who have a job, who have to be there from 8 to 5, 8 to 6, longer, get there earlier.
Okay.
They probably bear and grin it.
Oh,
with all the pain that they have, using all kinds of medication because they have to be on the job. You have a family, they got to do the grocery shopping, they got to cook the food, they got to do the household, whatever is needed as either being a couple or being parents or having children with issues or working for themselves. Whatever it can get really complicated, and many people literally feel, I don't have time for this.
Yeah.
But they do have time to pop the pills and to go on. But I can only imagine the tremendous stress many people are under today, because they may not do the kind of work they like to do. It may be hard work on their body. And I'm just not talking about people who physically work, but also people who sit down a lot behind
Oh, that's
desks
one of the
and
worst
everything.
things.
So you add it all up, you realize that many younger people of today have issues. And I enjoy going to the gym. I go 5 days a week, and you see all kinds of shapes and ages and people working on their own issues. And sometimes I just have the feeling people look at the watch and say, I got an hour and I got to get as much done as I can.
Yes.
But it is not always goal oriented. It's simply I want to finish my routine, and they're not working towards really helping the body heal. Is that something that you have observed as well?
Oh, indeed. And
So to go to somebody like you and get some insights what they should be working on for the time being would probably be a good idea.
oh, indeed. What I find is people are typically doing the opposite of what they need to do. If they've got, let's say, name just about anything. Give me something. Let's say they've got a shoulder. They've got a shoulder issue. Shoulder's locked up. They can get
Like a frozen type
like
shoulder?
a frozen type shoulder. Frozen shoulders, releasing those all the time. There isn't probably 2 days out of the week that someone doesn't come in with a frozen shoulder. And they've been the general medical route, and they've been told, this is all we can get for you. Goes with physical therapy. They've gotten injections, cortisone injections or whatever in the shoulder, and they get a little bit of, relief. So they come in, and everybody, without fail, is going to where the pain is. When a person comes to me and they tell me, first of all, in our intake, I want to go through everything that could have affected that shoulder.
Okay.
Are they a golfer? Okay, we got a chronic issue with the shoulder there.
Sure.
Have they had any type of accident in the past? Have they had any kind of falls where they fell on that shoulder, or the opposite side? We have to keep in mind, generally where the pain is not where the issue is, but look to the opposite side. And we can get into that more. But if an individual, say, has a fall, and when they fall, the muscles on this side, say they fall to the left.
Correct.
The muscles on the right side are going to tighten up to try to lessen the impact on the left side.
Okay.
When they do, that's going to constrict what's going on here, and they'll end up actually having the pain on the opposite side. But it's not because of the impact, it's because of the tightness over here.
Okay.
So the doctors, the physical therapists, whatever, will be focusing on where the pain is over here. If you release what's over here, then this isn't trying to compensate anymore.
I see.
And we get that range of motion. So with a shoulder, the pain is typically right up in here. And so what's an opposite to that? Well, an opposite's going to be down into the lats. It's going to be into the pec minors.
Okay.
And so I'll go in and I'll palpate the pec minor muscles, and I'll find tenderness back up in here or at the interdigitation points where it goes into the rib cage.
Tenderness, you mean when you touch it, they say, wow, that hurts.
Yes,
That's what you mean
exactly.
with tendon. Okay.
No part of the body should hurt when it's touched. So if I touch somebody, if I'm palpating certain muscles, and they go, wow, that's tender, that really hurts, then I'll go, here's an issue. Now, what might be causing the pain could be either muscle tension, but more often than not, you'll find these ischemic knots in the muscle. So all of our muscles are wrapped in fascia.
Correct.
Fascia is such amazing stuff, and we're still discovering more and more about it.
Yeah.
But you figure every muscle cell is wrapped in fascia, every group of cells, and then the muscles themselves as well as, So if I took all the fascia out of your body and just laid it out flat, it would cover a football field.
Really?
There's that much of it.
My goodness.
And that fascia has over 250 million nerve endings in it. So when we typically would say, well, I know where my hand is in space because of my nerves. In reality, I know where my hand is in space because of the nerve endings in the fascia that tell me all the way along the neural path where things are and what they're doing. If I took everything out of your body but your fascia, you'd still be recognizable.
Really?
That's how delicate and intricate fascia is. Now, bearing in mind that the fascia has all of these nerve endings, that means that it responds to certain traumas, certain issues that you might get into, movements or something of that nature. So if we have a traumatic event, whether it's just like trying to do a clean and jerk,
You bet.
and it's a little bit more than you should, and then you find that, well, I've got this muscle, I've got this pain that's going on somewhere in the chain.
Yeah.
Then if it's back here, then I'm going to look into the bicep. And so you'll find, oh, hold it, it's tender right there. And not necessarily the whole muscle. There's just a knot right there.
So the bicep did the work, the tricep is holding on to it.
Exactly.
Yeah.
And so now the bicep is going to hurt, but if I push back here, I'm going to find tenderness in the tricep. So the bicep did the work, and when the bicep got locked in this position, or what happened is the bicep overextended, or in this case, overflexed. Now the tricep is trying to balance the tension that's in the bicep. And because that tricep stays, because we have to remember, we have primary movers and we have the antagonists as well.
Okay.
So the bicep being the primary mover, the tricep being the antagonist, that antagonist is tightened up because of the tension that's here.
I see.
So if I release, so you'll get this pain that comes right down around to the elbow.
Yeah.
If you follow it, it's coming right down the tricep. So we release the tension in the bicep here, the pain goes away down through here.
Interesting.
So with the shoulder situation,
Yeah.
if we get into we palpate through the pec minor, we'll find these tender spots in here. And then once we've gotten that resolved, we can go back over into the lat, because this pain is not because of what's going on here, unless there's a tear.
Yep.
This pain is because there's a battle going on between the pec minor and the lat in the back. And then the shoulder becomes the battleground between the two.
Exactly.
It's like, say, knees. So many people have issues with knees. More often than not, the knee is not where the issue is. Most of the time, that's not where it is. And I'll have people that come in and they say, well, I'm bone on bone.
Correct.
And I'll say, you can't be bone on bone. Well, the doctor showed me on the MRI, it's bone on bone. I said, but you can't be bone on bone. There is a sac in there that has fluid in it. But right now, the muscles on the inside of your leg, and that's generally where it starts, is on your adductors on the inside of the leg, like the gracilis or the other adductor muscles that are there. That starts to tighten up, and it happens with people that are riding horses or motorcycles, people that are, you might...
You have to hold a tight grip.
Yeah.
Yeah.
And so and a lot of times people that are working out in the gym, they'll be doing their adductors really, really hard. and not so much the abductors out to the side.
Correct.
Well, you got to keep balance.
Yeah.
And so when they do that, then this muscle starts to develop more and more tone. And
So you got it.
tension
If you
in
do that specific exercise, make sure you do both the same weight.
Exactly.
Same weight.
Exactly. I'm a real proponent. If I'm going to do curls, then I'm going to do extensions.
Correct.
And so at the same time, otherwise I'm going to overbalance.
Mm-hmm.
And so they get this tightening up on the inside of the thigh. Then the IT band on the other side, because this comes down and it attaches to right below the knee,
Yeah.
the lower leg. Well, the IT band starts picking up this tension that is pulling that lower leg to the inside.
Mm-hmm.
Well, when that happens, the IT band shoots this little message up to the TFL muscle that comes up into the hip.
Yeah.
And is attached into, it's part of the glutes. So the TFL muscle says, whoa, 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 we can't have this. So the TFL muscle starts tightening up and pulling on that IT band to try to bring it back over this way. Well, then what happens, we start getting this compression. Again, we've got a battlefield in the knee.
Mm-hmm.
And that happens more often than not. The place where the pain is, plantar fasciitis is the battleground of the flexors and the extensors in the lower leg.
Yeah, yeah.
And so in this particular case, we go in, we release all the knots and tension on the inside, the adductor muscles.
Yeah.
Then we come around and we'll find sensitive knots right down through the TFL and down into the IT band. We release those, the knee's fixed. Then they can high step, they can move their leg around.
And you can
There's
do a
no
lot
pain.
of this in one session.
Yes.
Wow.
Typically, and I have to be careful not to use the word fix or heal.
No,
I don't,
I know,
because
I
I'm
know,
not, you know,
but-
I'm not a doctor.
Yeah.
But all of my patients will tell you, 90+% of my patients will tell you, yeah, it works. And so we have people coming in with knees that have been scheduled for knee replacement. They call and they say,
Knee
"Well,
replacement?
don't need it." Yeah,
Wow.
knee replacements.
Huh.
People that come in with carpal tunnel. Carpal tunnel is not an issue of the wrist and hand. It's an issue of the muscles up into the forearm.
Mm-hmm.
So every person that comes, if you meet a person and they say, well, I have a real bad case of carpal tunnel, you just come up onto the forearm, just below the elbow, and you just press on the muscles right through here or right through
And they're
here.
probably really tender.
And they're going to say, ooh, that's tender.
Yeah.
Those muscles, once they're released, no problem.
So you give them a suggestion to kind of massage that at night a little
We
bit?
do.
Rub
We
that
do.
through? Okay.
And I'll tell people, I want people to be whole. I want people to be pain-free.
Mm-hmm.
To the point that, like I said, I don't set up treatment plans. I try to fix them the first time I see them. It's very rare that I see people repetitively, unless they hurt themselves again.
Mm-hmm.
And so I'll tell them, here's a stretch that you can do, or here's a place that you can press, or have someone else press for you, and it should relieve the tension in that should relax that muscle. The tension goes away on the end where the tendons are attached,
Yeah.
and the pain goes away in the joints.
Mm.
And people that have had it months,
Yeah.
years.
The interesting carpal tunnel is also a symptom of a low thyroid.
Yes.
So people who have low thyroid issues, Hashimoto's or just low thyroid, they may have carpal tunnel.
Yeah.
So how would you work with that? You
Well,
still deal with the same issue.
My question is, which
Yeah.
came first, the chicken or the egg?
I don't know.
You know,
that's a long time. That's a discussion that has made it through history. We're not going to solve that problem here.
So is the issue with the thyroid being caused by
Thyroid.
Is the issue with the thyroid being influenced by the high level of cortisol from the pain that they're having in their wrist? Because cortisol can affect everything
No,
negatively.
cortisol is adrenals, thyroid, pituitary, axle. Yeah. Okay. Interesting.
So if we can resolve the pain issue, then can that possibly have a direct effect, positive effect on the adrenals, the thyroid, and so forth? I mean, it does emotionally. I had a lady come to see me She had fallen a couple of years ago in February, injured her shoulder, had been on two opioids for pain, and one antidepressant. She came to see me in December. She had lost 60 pounds. She was scheduled for surgery, shoulder replacement. And when she came in to see me, she was just a miserable case. She left. She had almost no pain. It had reduced that much. She came the second time. When she left, she stopped taking her pain meds, came off her opioids right away, came off her antidepressant, canceled her surgery. Workers' compensation called her and said, what'd you cancel your surgery for? She said, because I don't hurt. Well, how's that possible?
Yeah.
Aruka touch. And they said, well, what's an Aruka touch? So she explained. And they ended up paying for her to have 12 more visits. They wanted to make sure she was really well fixed because we just saved them tens of thousands of dollars.
You bet.
You know. So, and that's what happens with these potential knee replacements. Because when we release that tension in the knee, then that capsule that has the fluid in it is now relaxed enough that the fluid comes back into it, and now the knee moves smoothly without any kind of friction or any kind of pain.
Super interesting. Super interesting.
It's wonderful stuff.
It's releasing blockages and letting the blood and the lymph and the nerves flow again.
Yeah.
Communicate.
Synovial fluid. I mean, everything. It's like the interview you had with Dr. Bott. I had the privilege of watching that. Super good guy. I like that.
Yeah.
It was a good interview. But like he was saying, getting all those fluids freed up to be able to move through the body the way they're supposed to.
Yeah.
Things begin to resolve themselves. We just, by going in and relaxing the tension that's in the muscle, releasing those ischemic knots that are in the muscles, we're able to enhance that so much more quickly that they are within a matter of hours, generally, to the point where they feel like they're brand new. You know, you were talking about how today's lifestyle with all the sitting, because so many people are, their jobs are sedentary, you know.
Driving in a car, sitting behind a desk.
Yeah, it's a new quick way to death.
And then when they do move, then they haven't practiced, so they do ask the body to do something. It's rusty to do it almost, you know, tight.
And those people develop lower back pain more than anybody else. And so they'll come in and they'll say, you know, I've been to the chiropractor, I've been to a massage, I've been to the doctor, I've had injections in my back, and I still have this terrible low back pain. And so, all right, let's talk opposites. If the back's hurting, where's the issue?
In the front.
In the front. So we have two sets of muscles, our hip flexors, the iliacus and the psoas, in the front portion of the abdomen.
Yeah.
When we are in a sitting position, they're short because they're not being extended at that time.
Correct.
Muscles that are in a shortened position lock in that position, we call it, because they don't since they're not being
They're
extended.
not asked to extend. Right?
So when we do extend them, then they start pulling tension because they're not used to being fully stretched. That's why stretching is really good. You know, doing lunges is super good for the iliacus and psoas. But that's not what people do. You know, the most stretching they do is get up to walk over to do this or that, you know. And so those muscles being locked in that short position for hours, then they stand up, and next thing they know, they're starting to have this nagging pain in the lower back. And then they go and someone says, well, you've got this acute issue that's taking place with your L5-S1. And that's where most people end up having herniation in the discs, those cute little jelly donuts between our vertebrae and our spine. And they start to compress. Well, why is it compressing? It's compressing because those two sets of muscles are so tight that with the iliacus, it lines the pelvis and comes down and attaches to the femur just inside your groin.
You bet.
So when that is shortened, then that starts to pull anterior tilt in the pelvis. So if the pelvis begins to tilt anteriorly, that's going to exaggerate that curve in your lower back. We call it the lordotic curve. Well, as you exaggerate a curve, it gets weaker. And so that's what's happening with the lower back from that standpoint. And that's when we start seeing short leg, long leg applications.
I see.
So because it doesn't do it evenly, and so as you're tilting that, getting that anterior tilt, and one side will start to tilt a little more than the other does, that's putting additional stress on the lower back, because now not only are we causing this curve to exaggerate, we're starting to twist it a little bit. So when somebody comes to see me and they've got lower back pain, and I do an assessment on them, almost without fail, they'll have one side of the hip that drops a little bit more than the other, twists forward a little bit more than the other, and they're going to have a discrepancy in leg length, anywhere from 1/4 to an inch.
Wow.
Unfortunately, if they go to another practitioner, they usually are given wedges for their shoe, or they get orthotics.
Right.
And now you have put them on a crutch that they're going to have to wear from now on. They're going to still have the pain. They're still going to be limited in their ability. They won't have the freedom in their hips that they need.
But they just have a little less pain, and then
Yeah.
you see that as an improvement.
Exactly.
But the body is still messed up.
Absolutely.
And if the body is trying to get your attention to your symptom, if you start slowing down that symptom or eliminating a symptom, it's going to find another part of your body to get your attention.
Exactly. You know, like we said in the very beginning, if you start to get a kink here, then it starts to do something here, and the next thing you know, your neck's hurting because your butt's got a problem, you know, type thing. So what we do then is we release that tension in the iliacus and balance the muscles on both sides. Immediately. I've never had one fail yet. And I've been doing this for 5 years. I've never had one fail that by releasing the tension in the iliacus, the leg length deviation was gone within 45 minutes to an hour. By doing that now, we've released that stress and tension on the lower back, so we're beginning to relax the pain in the lower back. Now, let's throw into that the psoas as well, because we have all these people that come in and they say, well, I've got a herniated disc, or I've got spinal stenosis.
Too many
or
people.
Spondylolisthesis even, where it's pulling the vertebrae out of alignment in the lower back. This is because of all this tension that's pulling down, because the psoas muscle, it attaches basically in the same place in the groin, in the femurs. But instead of attaching to the pelvis, it comes up and attaches to all 5 of your lower lumbar vertebrae and your 12th thoracic vertebrae, the last floating rib vertebrae.
Does it also connect with your pelvic floor muscles?
It's part of the pelvic floor muscles. In reality. So we're talking about from right about up in here, all the way down, longest muscle in the body, all the way down just inside of our leg on both sides. When that muscle has been in a sitting position for so long, or if we have strained by lifting something that the muscle went into a spasm, now it's tightened up. And so it's starting to compress those 5, because we're probably 85-90% of the time, if someone's got a herniated disc, where are you going to find it? In the lower lumbar, in the vertebrae that are attached to the psoas. So by going and releasing the tension in the psoas to where it can now fully extend and relax, immediately the pain is gone.
Unreal.
The muscles,
I mean, it makes sense, but it's still unreal.
It is.
For most people, it's like, no.
I have people that get off the table and they'll go, I just work here.
Yeah.
You know, sometimes we might have to go into the Q house, but I'll just work through here. And
Yeah.
they'll get up and they'll go, where did the pain go? You didn't touch my back, but it's not there. Because that's not where it was.
Yeah, it's unreal.
It is.
That's amazing. That's amazing. It's amazing technique. I like to do a part 2
Okay,
with you.
absolutely.
Because I want to understand, obviously you're very passionate about it. That's pretty obvious.
Is it?
And I think that, and I think that viewers can see that and hear that in the way how you explain it. And you're not trying to make it complicated. You just, some of the words you use may be new to some viewers, but they get the concept that the body is trying to balance, the neuromuscular balancing. But I would like to ask you in another interview how you got here, what was it in your life that triggered all this interest, and then some of the comparison with other modalities that are out there. Not to put them down. Everything has a value. Everything has value, and people have gone to school for many, many years trying to master a certain talent, a certain modality that for them is really working. But also, I think that for people, when it comes to do it yourself kind of a thing,
Yes.
that you're giving them some great pointers.
Yeah.
So
Yeah,
you
we
want to
people-
stay for another interview?
Oh, absolutely. I'd love it.
All right, cool.
Love it.
Well, hopefully you come back and listen to part 2 of this interview with Lee Forbes, and he is with Aruka Health Inc. Aruka Health
Aruka Touch.
Aruka. That's what I meant to say. He's with Aruka Touch in Beckley, West Virginia, but he is with us in the studio explaining his work. So come back for part 2. Thanks for viewing. We'll talk to you soon. Bye-bye. Awesome.
My pleasure.
Visit healthinfocusnow.com